You saw this coming years ago. No one really listened to you then.
I listened to you. Just
well,
for
a
the
lot of
record.
people watch your TED Talk, but the changes weren't made. The tens of billions of dollars you talked about that would be needed to invest in fast tracking vaccines and in monitoring zoonotic viruses and the like, it wasn't spent. If authorities are listening to you tonight, what is your advice, or leaders are listening to you? What's your advice, and is a vaccine the only avenue to this ending, or what happens between now and then?
Well, testing numbers will keep going up, and there's some breakthroughs there that could get us into much larger numbers, what I call mega testing. The therapeutics work, dexamethasone, that's real, that's great. Some new ways of formulating remdesivir, and there's 2 other drugs that in the assays show effectiveness. We will get the death rate down. Monoclonal antibodies are about the only thing that could get it down dramatically if that works out, and we'll know by the fall. We do need to think about the world here, and that I'm still pretty disappointed. And without U.S. leadership, it's been hard to pull together, a response. And now the developing countries are bearing the brunt of the burden. Brazil it's very tough there. India's starting to be very tough. So, innovation will help solve this. My TED Talk, 90% of the views are after the pandemic one started, not before. And yet there are groups, we funded CEPI. It wasn't, even a 20th of what should have been done. I do think people won't forget this. I do think it's clear it's possible to ramp up testing for a new pathogen very, very fast. In fact, a number of countries did that extremely well in this case, and the technology just keeps getting better there. So I'm not fatalistic about future pandemics, even though I'm disappointed we didn't get ready for this one. And even during the pandemic, the U.S. in particular hasn't had the leadership messages or the coordination that you would have expected.
But basically, we're still not doing enough now on this pandemic.
No, not even close. I mean, just, people died today.
Is there any reason beyond our poor response in this country to this virus to explain why we, with all our resources in this country, why we are the worst off country in the world right now with the most deaths and cases?
Well, the United States has had a tough time. We're not as tough on contact tracing or enforcing quarantine, and the compliance with mask wearing in the U.S. is far less than particularly in the countries in Asia. And so Europe's seen a much greater drop in cases than the United States. The health experts and others like myself are saying, hey, let's not lose sight of this. Even though the weather is helping us a bit, May would have been much worse if the virus wasn't somewhat seasonal. And so we know now that we're benefiting from the summer, and so force of infection will get worse in the fall. So all the more reason not to get completely lax in our behavior. The only good news in this is that the death rate has gone down somewhat as we're learning how to treat people better, we're less overloaded. But the global picture and the U.S. picture are both more bleak than I would have expected.
Bill, thanks so much for coming back to speak with us. I thought we'd be having a different conversation, frankly, end of June about this. Last time we spoke, I asked you about cognitive dissonance, this idea that people are already taking victory laps, acting as if the pandemic is over. How much do you think that's contributing? I mean, we know about the testing issues. We're going to talk about that, masks, physical distancing, but just the mindset overall. How much do you think that's contributing to this cognitive dissonance, and why? Why here?
Well, it's almost as though people have a willingness to go into lockdown once and, for a certain period. And that, maybe that's not surprising. Then it takes to get them to extend it past a certain thing, or even to inconvenience themselves With masks, requires maybe somebody they know to not only test positive, but maybe get very sick as well. And so the range of behaviors in the US right now, some people who are being very conservative in what they do, and some people who are basically ignoring the epidemic, it's huge. And we've worn out people's patience, and if they don't see it in some way, some people almost feel like it's a political thing, which is unfortunate.
The White House continues to promote this idea that the reason we have the most cases is because we do the most and best testing. When I say we mean the United States. Just to be clear, the idea that testing is the reason why the United States has so many cases, the allegation is that testing is giving a false sense of the spread of the virus. Is that factually correct?
No, it's completely false. It's fair to say that you can find more cases when you do more testing, but the U.S. is experiencing a rebound even once you factor out the increased testing. And, it's true, the local authorities over time have gotten their act together on testing, no thanks to, a broad, clear message from the federal government. And that testing, our foundation's been funding certain innovations like the test-at-home swab and various ways of processing the samples. And so in the fall, the testing capacity will continue to go up. That's good news. But that's not the reason why we're seeing these case increases. If you take New York or the New York area out, in fact, we're still very much in the thick of things. And better treatment is reducing the deaths. But particularly as you get into October and November, this thing will be back in big numbers if we don't restrain our behavior more than it looks like we are right at the moment.
If you start to look at the actual numbers of tests, what you'll hear is the United States now conducting over 400,000 tests a day, which, as you point out, significantly better than we were. It was less than 20,000 a day, I think, back in March. But I think the question comes up is, what is the right number, right? Because what you keep hearing is, we've done 25, 26 million tests in this country. It's far more than other places. So what's the problem here? Isn't that enough tests? Is there a right number?
Well, with testing, there is an approach that people talk about where you do mass testing, but 500,000 a day, that means over a course of a week, you're testing 1% of the population. So that's still a very scarce resource. You have to confine it to people who are either at very high risk or who have symptoms or had contacts with somebody who tests positive. If there's breakthroughs that let you get from 1% a day, 1% a week, to more like 10 to 20% a week, then you could use mass testing to find cases. But no other country has relied on that. What other countries are doing is they're restraining their behavior, including using masks better than us, but they're also quarantining when they test positive, and they're doing contact tracing. And there are states that are very serious about contact tracing. It's been slow to get going. It hasn't worked as well here as it has, say, in Germany or South Korea or Australia. It's partly when you have a large number of cases, it's very hard to get right. People have a sense of privacy that are tough. The applications have not really, the software hasn't added much to it. So because our behavior and our contact tracing is not working well, we continue to have very large case spread. And it is embarrassing versus, say, Europe or other countries.
You and Melinda have worked around the world on viruses and diseases. You've had incredible results in many different parts of the world. And you're dealing with vaccinations in places, which is obviously politically, socially, a very controversial issue in a lot of places that you operate. Have you ever, in your vast experience, seen a situation where fighting a virus or a disease has become so politicized, where the act of wearing a mask now seems to be a political statement in some way?
I wouldn't have expected it here in the U.S. The governor of North Dakota, a friend of mine, had to say, "Hey, please don't be mean to people who are wearing a mask," which kind of blows the mind. We have seen the equivalent in polio eradication, where there'll be rumors that the polio vaccine is to sterilize women and that you really shouldn't go near it. And so, yes, vaccines are often subject to these rumors, and those rumors are just so hard to get rid of. Even the thing from the past where they said it was associated with autism, which trial after trial showed that that's absolutely not the case. You just can't. The bad news travels faster than the truth.